Well, East Cooper Medical Center knows health, and experts at its Lowcountry Plastic Surgery Center sure do know women. And doctors are ready to help moms post-baby with Royal Mommy Makeover. And Dr. Jack Hensel is with us today. Good morning to you.
Good morning.
And you know, we had a chance to talk a little bit earlier, and I said I can kind of relate to what we're going to be talking about today. But for moms who have had their babies, and usually body image really does become a factor. So when someone comes to you, what are some of the areas that, of course, that they are most concerned about?
The most common areas tend to be the breasts, the abdomen, kind of the midsection. There's other areas as well, but those are most common.
And of course, those are the ones that go through the most changes. And I experienced one of the two. I'm not going to say which one. And also, I had the surgery done there at East Cooper Medical Center, so you guys are very, very great over there. Mothers are really concerned about getting their bodies back to, or as close to being back to what they looked like before, correct?
Yes.
And so what are some of the questions that they have prior to, of course, like how long is the surgery? Is this going to hurt? Is there any kind of scarring that's going to be involved? What are some questions that they also ask you about?
Part of it depends on what procedure they're looking for, what procedure they're in need of. So sometimes they're short procedures, sometimes they're longer, sometimes they're the combination of, you know, breast, tummy, etc. So really it kind of depends, but the range of procedures can last from 3 hours to 6 hours. The recoveries are pretty much the same for every procedure, more or less, at least the restrictions that I give them, although some people do progress a little more quickly. It's just kind of individually, you know, it varies to each individual person. But most people do very well. They have, you know, they get through the pain pretty quickly, and I think that's probably the biggest thing is how long does the pain last, and when can I get back to regular activity? And
I think after the surgery that I had done, I was back to work in probably 4 days or so, because I did it part of a weekday and over the weekend. But when you find that they come in, are there different types of surgeries that are invasive or non-invasive? Are there different types of things on the market now? Again,
yeah, it depends on what the person needs. Some, you know, some of the people that have less, let's say, damage to their abdominal wall, for example, sometimes they don't need a tummy tuck or something to tighten the muscles or to remove a lot of excess skin. Sometimes it's just a little bit of excess fat that tends to be resistant to diet, to exercise, and sometimes we can do liposuction procedures. We also have a procedure for cellulite, which that doesn't necessarily
come from having baby, right?
But sometimes it can. So there's a new procedure that's been approved by the FDA to treat cellulite called cellulase, and it's a wonderful procedure. It has excellent results. It's got about a 3-year follow-up now from the initial studies, and we are the only practice in the state of South Carolina to offer that procedure at this point.
All right, awesome. Now also, most patients, they don't have to wait until after they've had a child. They can start kind of preparing their bodies prior to their post body, if you will.
Absolutely. There are, you know, again, it depends on each person's individual problem areas, that, or at least the areas that bother them, and what they need. But there are certainly less invasive procedures, even weight loss procedures. You know, for some people, they really need to do some weight loss, or would be better off doing some weight loss prior to having a surgical procedure. And I think as long as you get close to your ideal weight, you know, within 10 to 20 pounds, I don't think it really makes any difference as far as the outcomes. But you know, if you're a long ways away, you know, you may have a little bit of a lesser outcome than if it's closer. But we do offer a weight loss procedure, a weight loss program in the office that has been extremely successful. We've been doing it for, I guess, 2.5 years now. And we have a great success rate and very, very happy people.
Okay, and one final question for you. What are some other, the larger procedures that you may do at the East Cooper Medical Center?
I do basically, the majority of my procedures are at East Cooper, and I do breast reductions, I do tummy tucks, we do liposuction, we do breast reconstruction, all the various procedures that go along with that. You know, pretty much everything is there, and you know, my biggest single procedure is probably right at about 3 hours. So, but again, we do lots of combination procedures.
And I've experienced one of those 3-hour surgeries as well. And of course, the information right there, the telephone number for you, 884-7031. Dr. Hensel, thank you for joining us today.
Thank you very much. It's glad to be here.
Well, why sitting still should not be an option for you. Just ahead, how exercise saves lives. And spring means the Cooper River Bridge Run, but fall means the James Island Connector Run. They're already getting ready. We've got the details for you just ahead.